what in the world are we going to do about alcohol? Because at this point, I am utterly confused. On the one hand, you've got the World Health Organization telling us that all booze is dangerous, there is no safe amount, but now you've got also the U.S. Surgeon General putting a cancer warning label on alcohol, on all of it. Right there on the bottle, right there on the can, cancer. The message, just one drink a day and your chances of cancer go up. Okay, but what's the research say? Well, we just got a dignified new report this very month from the U.S. National Academies of Science, Engineering, and Medicine, and guess what? Yes, they found a cancer risk, but they also found that drinking a moderate amount of alcohol actually lowers your risk of dying. So there's like a not dying benefit compared to not drinking at all. So what I think this means generally is that America continues to be absolutely, totally confused when it comes to alcohol. And by the way, this has always been the case. The country was founded by absolute, total luscious. This is a real bar tab, by the way, from the founding fathers. 55 people, George Washington among them. One night in mid-September 1787, a heady time, they were working on the Constitution. They had 60 bottles of claret, 54 bottles of Madeira, 22 bottles of porter, 12 bottles of beer, and 8 bottles of whiskey. Oh, and for good measure, 7 large bowls of punch. That's just 55 people, folks.
Is that real?
That's real. That's a genuine bar tab from the founding fathers. And then that country that they founded decided at one point, not too long ago, to update the Constitution they wrote and ban alcohol entirely, but then repeal it, and then put age limits on drinking, but then change the age limits, and now maybe a cancer warning label? Alcohol and human beings have been working together to great benefit for at least 10,000 years, but we would have figured out at this point, is it good or is it bad, terrible or great, or somewhere in between? I'm so confused.
That was delightful. Thank you for that, Tony. You're right, it's very, very confusing, and we have a researcher who can clear it all up for us. Priscilla Martinez, she's the Deputy Scientific Director of the Alcohol Research Group, which studies drinking patterns and their effect. Priscilla, thank you so much for joining us.
Thank you very much for having me.
So Tony just laid it out. There are bits of research that seem contradictory. You know, let's talk about that National Academies research that found that alcohol may extend your life, but we now know that there is a cancer risk. How do people square that? What should they do with that information based on your research?
Well, there are some important differences between what the NASEM report found and what the Surgeon General is saying. So the NASEM report, as you noted, reported that moderate drinking is associated with a lower risk of dying from any cause. So this is about things that are related to alcohol and things that are not related to alcohol. The Surgeon General's report, on the other hand, looked at the body of evidence about alcohol increasing the risk of developing cancer, an alcohol-related cancer. So these are two different things that we're looking at. Another important thing to remember is that the NASEM report had very strict criteria for what studies it included in its report. It only looked at studies over the last 15 years, and it only looked at studies that compared drinkers to people who have never had a drink in your life. And when you apply that kind of stringent criteria, you end up limiting the research that you look at. So the Surgeon General's report, on the other hand, looked at the whole body of research that we have been accumulating for decades about alcohol and cancer. And that's partly why there's this discrepancy between what you hear is coming out from the NASEM report and what the Surgeon General is recommending.
But Priscilla, if you know, out here in trying to live land, I don't care about cancer in particular. I care about living versus dying. And if this other report seems to suggest people who drink moderately, so within reason, within control, are less likely to die in any given year than people who don't drink at all, that seems like they should put a health benefit label on the bottle.
Well, it's really interesting that you say that, Tony, because the outcome that NASEM looked at, the risk of dying from anything, is very different than the risk of dying from something related to cancer, right? So they looked at the risk of dying from things that have nothing to do with
Okay.
cancer or
So
nothing
then,
to do with
Priscilla-
alcohol. But when you're thinking about whether or not to drink, you care about what that thing is going to cause you to die from.
So the reason I wanted to jump in is because you're totally right, and you're making a very smart distinction. But I think what's confusing out here for regular folks like me is, what's the bottom line recommendation for alcohol? Can we have some from time to time or not?
The risk of dying or developing disease from using alcohol is pretty low at moderate levels of use. We might need to reconsider what we mean by moderate drinking, but the risk for developing cancer goes up from your baseline risk from about 1% if you're not drinking every day, and when you do drink, if you're only having 1 to 2 drinks a time. And of course, alcohol is a part of our society, it's a part of our culture and traditions, and it improves people's lives in a way. And so they need to know what the risks are in engaging in this really common behavior. And that's what alcohol warning labels and discussions like this are about, making sure that the American public has the information that they deserve to make informed decisions about their drinking.
A 1% increase in risk in developing cancer. Did I hear that right, Priscilla?
Yes, that's based on, I'm thinking about alcohol and breast cancer in particular because that's what I'm interested in. But if you are drinking about 1 drink a day, your risk of developing breast cancer is just about 12% because you're a woman, you were born a woman, and it goes up to about 13% if you're drinking about 1 drink a day on average.
On average. Thank you so much.
So it's not huge,
but it's something, and it's going up.
but it's notable.
But, and talking about what moderate is and how it's important to be moderate, also very important. All right, we'll see if these warning labels happen. They happened in tobacco, had a huge impact there. But we are out of time for now, Priscilla. Thank you so much.